Our speaker today is Emily Lian. Emily is from St. Louis County, Minnesota, kind of in the upper east corner of the state of Minnesota. And she's been a public health nurse there in Duluth for 12 years. She began her career as a family home visitor, specializing in serving pregnant and parenting teens. She then moved into the role of program supervisor for the family health, and she supports the South unit, started supporting them 3 years ago, and she oversees a team of 9.
So hi, everybody. Thank you for that awesome introduction. Again, I'm Emily Lian. I am a public health nurse in St. Louis County in the Duluth office. I will review a little bit about kind of the landscape of St. Louis County too, because we are a pretty big county, so things look a little bit different up here. So again, here's our objectives. We're gonna just kind of start by talking about the challenges and then review how we use the Omaha system and Nightingale notes in different areas of public health, and then also describe some opportunities, upcoming opportunities to really how we utilize that data in our system. So here is a little overview of St. Louis County. So we have 4 offices actually in our county: Duluth, Virginia, Hibbing, and Ely, with a total of 73 staff. We are the largest county in Minnesota by land area, and actually the largest in the United States by total area east of the Mississippi. So we do have a lot of challenges just related to the differences in our populations. We serve a lot of different communities, from like the Duluth area all the way up to Ely, which are very, kind of urban versus rural. And so we do a lot of different work in our areas. So as far as the Omaha system, we utilize it in a lot of different ways. Mainly we use this Omaha system with our family home visiting programs. Just a little touch, we did 3,300 home visits in 2024, which was pretty exciting. We also use this for disease prevention and control, which and tuberculosis case management, person of the day, which would be like public health nuisance and dog bites, rabies investigations. And then we also use Nightingale notes for time recording for all of our staff that are grant funded, so that when we need to report things to our grants, we can just kind of pull that straight out of Nightingale notes, which has been a really nice streamlined system. So here kind of are some of the challenges with our clinical documentation systems in public health. So most of us know that, clinical documentation really summarizes our clinical encounters, and it really can impact the quality of patient care and safety. Some of the issues that we have here in St. Louis County is the requirement for double documentation. In some of our programs, especially home visiting, we're required to enter everything into Nightingale notes and utilize the Omaha system for each visit that we do internally. And then we're also required to report in the IV system for the Minnesota Department of Health. The Minnesota Department of Health receives all of our information on home visiting clients through IV. So that's why we're required to do that there for them. But then we also have our clinical documentation in Nightingale notes that uses the Omaha system that we use internally. So that can get a little bit tricky. And when we talk about using the data to make decisions, the most important thing to remember is it really is only as good as what is entered. And so really making sure that there's a really good onboarding system and that everybody is kind of using the system in the right way, entering data as it's required to be entered. One thing we do in St. Louis County is for our time recording, our business services actually sends out an email to all of our staff to make sure that we have all of our monthly information entered by the first week of the following month, so that they can pull reports and send information to the grants, and also bill for all of our home visiting. And so that's been really helpful. And we have actually just recently in the last couple of years kind of streamlined what that looks like. We have a new dashboard for it actually. And so I'll kind of pull that up and show that to you guys later, which has been really, really nice. We also kind of use this data to track program fidelity and performance measures. So I listed some out here. And again, Roger has created a really great dashboard for this. So monthly, he just kind of uploads all of this information. into a Teams channel for us, and we're able to see how many visits a public health nurse did every month. So we're really making sure that they're on track with program fidelity, they're reaching the measures that they need to. It also monitors direct client time versus non-client time, which is really helpful just to know kind of where the staff are, what their needs are, what they're spending most of their time on. And so those two pieces have been really helpful in the last couple of years, and has been a great addition to utilizing information that we input into Nightingale Notes. So I am going to start talking about how we utilize the Omaha system. So we have 17 different tailored pathways. They're all listed here on the right side. And these are all created for clinical documentation purposes. So these pathways right now are all active. I know that asthma home visiting pathways are under construction right now, but the rest of them are all active. So these are all the individual pathways that we at St. Louis County have kind of internally created for our programs. All of our family home visiting pathways, which, you know, right here they state FHV in the front of them, those are all regional pathways. And so because we implement our evidence-based home visiting program on a regional level, we really wanted to mirror what the charting looks like again, so that those data pulls all look the same. And so those were created with the assistance of a team, regional team, as well as staff at our community health board. So then within these pathways, and we'll dig in, and I'm going to share our Nightingale Notes here in a minute. We also we do use the Omaha system for their problem rating scale. So we do knowledge, behavior, and status, KBS, when we open a client, if there's any significant changes, and then when we discharge a client. So really the purpose of that is to kind of tell the story of where they were when they initially started in the program, and then how far they came by the end of the program. And it's a really cool way to tell the story of a client just with that data piece. So it's been a really interesting thing to use. So aside, beside kind of this pathway work, this is some of the streamlined work that Roger has been doing. So if you look at this little chart on the right, this is what he pulls into a report for us every month. So Jordan O'Brien is one of my nurses. As you can see, she uses a lot of different kinds of funding. Our family home visiting unit is run through braided funding, and so it makes total sense that hers looks like this. A lot of other people are just work under one grant, and so they don't necessarily have to split it out like this, but you can kind of see where she spends most of her time, where she documents most of her time. For some of our nurses, they have like a 0.25 FTE in strong foundation. So they're supposed to document, you know, a quarter of their time every month in there. So this also helps nurses know if they are on track with their documentation. So, but again, kind of the things that have been working are these performance measures. So even though this documentation piece it can be really heavy and irritating to nurses, as long as they understand the why, I think that makes it a lot easier for them. So when they can look at something like this and understand, okay, now I know I have to split everything up into these different grants, it helps them to kind of buy into it and understand the importance of it. So this has been a really, really helpful piece for us. We touched earlier again on the piece of using KBS in a more standardized way. I love the idea of those built-in reports in CHAMP. I did not know about those, so I'm excited to play around with them. I touched on this again in our Omaha training that we did, but we are doing a new Mothers and Babies initiative. So Mothers and Babies is an evidence-based intervention to help manage stress and prevent postpartum depression in the mild to moderate categories. So how it is really utilized is an individual can go out and do a Mothers and Babies intervention. individually with a client, or it can be done in a group setting as well. And so it's really prescribed, but there have been some sites in the past that have done pre and post patient health questionnaires, so a PHQ-9 and a GAD-7 for depression and anxiety. And so we're really hoping to utilize our internal documentation system to collect some data to really show the progress, not just in KBS, but also the progress within their screenings. And so that is something that will be coming up probably later 2025, early 2026. This is just exciting work that we do, and it's nice to have a documentation system that can really work for us and not against us.